Welcome to Truth Custom Made. Come in and have some lemonade. Reality will readjust while we evade the issues that are pressing us and getting so depressing. But undressing and unstressing makes them go away. We're tired of solid ground. We're wired of the sound of any fool who keep us cool with all his lies. Cool with all his lies. Ba, 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 ba.
Hey, this is Lance Baker here, and I want to talk today about what happens when you first go into those doors of the psychiatrist office, and for whatever reason, for no fault of your own, you now find yourself having to actually go through those doors and actually see the psychiatrist, for yourself, for you, not for mom, dad, brother, sister, son, daughter. Those are the easy ones, like going to the dentist. You go in there, you just sit there with your iPhones and stuff. But this time it's now for you. And you go in there and you think, oh boy, here I am, I'm a healthcare provider, nurse, whatever. What happens if someone's going to see me, going to run into somebody that I know, or am I going to come out, now I'm going to be labeled like one of them, So you go in there and it's a big blow to your ego. It's already being shot. So you go in there, you fill out the paperwork, they send you into the back, they put you into the office, basically just in this chair thing, and you kind of wait. And you're there for what's called an intake. And it goes about 30-40 minutes. And what happens is the psychiatrist person comes in there, and they sit down and they just have you start talking about your whole life story. What got you here, what events took place for it, did you have any thyroid tests done, what were the results of that, were you on any recent medications, steroids, what about those, were you doing any drugs, alcohol, that goes into play, what runs in the family, those normal ones, and then they ask you about what happened, and you spend a lot of time talking about your story about what happened, and occasionally they'll give you prompting questions, and over the course of 30-40 minutes, it gets pretty invasive. They start asking you about your thought patterns. They ask you about your spending habits. How were you spending? Were you drinking? Were you having any your sex life? Basically ask you about your sex life. What behaviors were you taking part in? All these different things. And your main reaction is, what the heck, what's this got to do with anything? But you stick with it, and you just humor them, and they want you to be honest. You be honest, because what is happening is they're looking for specific behaviors, and for me, it's a lot of things like straight depression, and the bipolars, the cyclomanias. They all fit under this one umbrella called mood disorders, and it's almost similar to the COPDs in that here you have this encompassing term, and all these things are within it. So like with COPD, you got emphysema, and then you got chronic bronchitis and some other things, and that all goes under the umbrella of a COPDer. And then we just use that term COPD, which is basically a generic term. Or like saying sepsis, oh, he's got sepsis. Okay, so what does that mean? Well, is it a UTI, pneumonia? It's another encompassing term with all these different diagnoses in it. Same thing, mood disorders. You got straight depression over here. You got your bipolar 1, bipolar 2, cyclothymania. And so the treatment's different in each one. If is this a straight depression in which that your friend or internal medicine doc practitioner puts you on SSRI like Zoloft or Paxil or something, and it just didn't take. Were you on a medication for something else, anxiety, whatever, and now all of a sudden you went into this mania or hypomania, or were you going alternating between depression and mania, depression, mania, depression, mania? So each of these has a specific way it's treated, and not the same type medications. So in my case, how they figure it in determining between the bipolars is your bipolar type 2, which is what I am. You got to have X number period of time you're in a depression. You're actually in a depression. And so you have to determine how severe that depression is. And did you flip over for at least over 4 days into a mania or hypomania state? The questions for mania are the same. It's just a matter of length of time and severity of the symptoms. And there's a criteria that has to be met. There's like 7 or 8 different type items, and you got to meet like 4 of them out of them. And it's all got to be taking place at the same time. Not like 3 months, I had this once, I had that. No, it's got to be all within a certain thing. Like for me, it was being irritable on one side, which basically can fall into the depression phase for guys. They tend to get irritable and cranky. And then all of a sudden, here I am with this militant type goal in there, and I'm attacking it head on, and it was set off my mania state. And I'm there for 2 straight days going without sleep. And I was sending hundreds of emails out to the entire United States Congress, the entire United States Senate, and the White House, and for 2 days. And otherwise, I was fine functioning and all that kind of stuff. But that's all I did for like 2 days. Had that, and then they ask you about your libido and your sex drive because it's got to come in there. And then was there any excess spending going on? Maybe you were being, in some cases, inappropriate at that time, or I wasn't, but you may be flirtatious, all these kind of things when your libido is like sky high. And so they're trying to decipher where you fall in under all this. Many times for the bipolar, it's still anti-convulsant therapy. Lithium is still used, but it's not as popular as it used to be. And then when like the Lamictal, the anti-convulsant Lamictal, came out, that became the big thing with the type 2s, and it still is. It's basically the number one preferred medication, and then you get into your Depakotes and those type anticonvulsants, but those usually require having blood test, and it makes you drowsy all the time, and you have to get the test, and you bloat, you get fat. So it is, they don't want to do that. And then are you in a phase, on a depression phase, where after they got you stabilized, do you need to actually go on a small, tiny antidepressant, which is still, they still do it, but it's more controversial. And are you a straight bipolar where you may or may not be in any depression phase, but then you just went straight into this manic phase? And those are your type 1s. Type 1s are the ones that a lot of times we will see in their emergency rooms in the ICU, because they're, what happens is the problem with the bipolars is like 2/3 of them have some kind of like substance abuse issues, and there is no real teaching people how to live with bipolar. And it's so bad that even 15 years ago, if you were trying to go to the library to find a book on manic depression, bipolar disorder, you could find it, but it didn't teach you how to live with it. It only taught you about this is your brain, and these are the chemicals, and this what this does, and that does, and this is what we're finding in studies. And it was nice medical jargon stuff, but it didn't do anything for you in reality. You may find someone's book in which they used it talking about their depressions and all that, and how they redirected it into their artwork and their poetry. But as far as actually living with it, there's not. Actually, there was only one, and that was Dr. Miklowitz's Bipolar Disorder Survival Guide. This is a 15-year copy. There's been like 2 or 3 other editions that came out since then. This is probably your best money for anything. It's worth the $15, 20, 25 bucks, or just go get an old copy for like $5 on eBay. It's all good information. Very little of it has changed. It's basically going to do what I'm going to do in all these different series. It breaks things down. It breaks down. There'll be times we're talking about sleep. They're talking about diet. They're talking about the medications. They're talking about why you don't do this, why you don't do that, and things that you can try to help you here and help you there. Other people there's another book that came out, the Bipolar Disorder for Dummies, and I haven't actually seen and looked through that, but it's similar to this one here. And then some people got where they just track their moods, their sleep habits and all that, and they hand it. This one particularly has a breakdown for how many hours you slept, your priorities. You do your journal entries, and then anything you're grateful for and anxious is about goes in on the daily tracker. It's good, but you have to kind of actually see these things first, because a lot of them will sell you $10 for nothing but notebook paper. So it depends what you're into. That is what happens on your intake. The problem is you're going to be coming back on a regular basis. You're going to, when they put you on the medication, they're going to want to see you there like within a couple weeks to a month at least for the first medication they put you on, and then start talking about either upping the dose. It takes 4 to 6 weeks for these medications to get their blood levels in the system enough for it to start doing you any actual good. And then at that point, they have to determine whether or not to go up on it. This is going to be a hard ordeal. This is the beginning. This is the beginning of the rest of your life, because now everything is going to have, your whole life is going to be more structured, more organized. Sleep is going to be your number one priority, and healthy living habits are going to be your number one priority. So it's going to be your medications and sleep. Your medication and sleep. You got to be doing your medications, sleep, and general health well-being. I'm going to go in this in another series. It's almost like being a hockey goalie in a way. But anyway, that's where we're going to go. I'm Les Baker. I'm signing off for right now. Hope you enjoyed this little talk. There's more talks about more topics that are coming up here on bipolar management for healthcare workers and the newly diagnosed.
Try to stop me.